It's heartbreaking when our furry friends get sick, and when the diagnosis is cancer, it can be even more devastating. But now there is new hope. The FDA has just approved a canine cancer treatment, the first drug of its kind in America. And here to tell us more is our resident vet, Marty Becker, who is Skyping in from Idaho. Hello, Dr. Becker. It's so great to see you having a great time in Idaho.
Oh, thank you for having me. Thank you.
All right, Dr. Becker, perhaps before we get into this new drug, you can tell us how many dogs get cancer a year. How big of a problem is it?
You keep hearing this term, there's 1.2 million dogs and cats per year get cancer, but by all estimates that is very, very low. In fact, cancer is the most common natural cause of death in dogs and cats in the USA and Europe, and the age-adjusted rate in dogs is higher than it even is for humans. And according to the AVMA, the American Veterinary Medical Association, half of all deaths over the age of 10 are from cancer.
So, Dr. Becker, this new drug, palladia, I believe it's called, must be offering so much hope. Can you tell us a little bit about it?
Well, let's go back to the cancer thing just a second. Of the cancer cases, about 1/3 of those are skin cases. And of the skin cases, about 1/5 of those, or 20%, are these mast cell tumors. And mast cell tumors are the second most common tumor type that we see as veterinarians. And in these mast cell tumors, they're often called the great imposters because sometimes they look like a fatty tumor. We call them lipomas. So they're this lump. Other times it looks like a little wart, and other times it's this aggressive, ulcerated mass that just looks angry and bleeding. And often what you see with clients come in, they don't complain about the lump or the wart or the ulcerated mass. What they actually talk about is that there's blood in their pet stool. There's a stomach upset. There's anemia, or even burping due to these gastric ulcers that the mast cells produce something called histamine. But before palladia, what we'd have to do as a veterinarian would be, if you diagnose the mast cell tumor, would be to do surgery or radiation if it was localized. If the localized treatment didn't work, you'd have to do to something more systemic, using chemotherapy, steroids, and other supportive kind of care for the ulcers like Pepsid and Benadryl.
And how effective were those treatments? Those sound like they would be pretty harsh for dogs to take.
Well, they're not only harsh for the dog, they're harsh for the owner. When you have to go through surgery and radiation, it's expensive. It's a major surgery for a pet. Then when you go through chemotherapy, again, you're trying to titer it out to kill the cancer but not kill the pet. And also for the owners, before palladia, what happens is there's syringes and there's scalpel blades and there's exam rooms. And the great thing about palladia, this enters a new era. It's a molecular therapeutic. And so it's a new era in cancer therapy when we no longer have to rely on chemotherapy, radiation, and surgery to defeat this disease.
Well, Dr. Becker, how does it work? Is it a pill? Is it easy for the dogs to take?
Yeah, it is an oral medication, and that's the thing that's great about it. Rather than when you think of, of course, radiation, we kind of all have an image of how that works. With chemotherapy, you have IV catheters in and there's drips. Well, this is simply a pill that the owner can give at home. And I can't overemphasize this. I'm a 30-year veteran veterinarian, and anytime you can go from the exam room to the living room for treatment, because you get to initiate the human-animal bond. It's given in that loving environment where you can give the good girls and attaboys and you're going to be okay. That in itself is so much more powerful to enhance the comfort and cancer control and cures.
Absolutely. And how effective is palladia?
Well, it is a new drug, and it's just going to be available from cancer specialists throughout 2009. And so we're going to see how effective this drug is, and it's in the research that's been done, 60% of the tumors disappeared, shrank, or stopped growing, and that is tremendously significant. And before, as veterinarians, we had to rely on human cancer medications. We didn't know how safe they were, how effective they were, so that's why the folks at the Veterinary Center at the FDA and at Pfizer Animal Health and the veterinary oncology community, I talked to Dr. Greg Ogilvie yesterday, who was at the Animal Cancer Center at Colorado State University for many years and is now at Angel Care Cancer Center in California. And he just said, it's a great day in the veterinary neighborhood. He's just so excited to have this targeted molecular therapeutic that's FDA approved and finally available.
Sounds so great, exciting for veterinarians and owners alike. Now, you were saying that it is very new here, but there has been something similar in Europe for a while, hasn't there?
Yeah, there was a drug called Mastinab, but Mastinab was a very specific for mast cell tumors. And the thing with palladia, it's broader in specificity and potential efficacy. You know, put in a layman's terms, there's a good chance it's going to work on more tumors than just mast cells, and it's going to be much more potent, much more effective in its treatment. So hopefully after the end of this year, we're going to know a lot more about maybe even some other cancers that this drug might work against.
Great, Dr. Becker. Thank you so much for all that information. And for more GMA Health, be sure to check us out on